We talked about what she could do for herself, about taking small steps, listening to her own heart, and acting in ways that felt true to her. Mm-hmm. When she came back for the next visit, she was so much lighter. Yeah, you could see it, so more open. And yeah, she spoke of a relief of the pressure she had carried alone for so long.
Welcome back to the heart of healthcare. It's been a while, and that time away was intentional. We've spent the past few years turning ideas into action, building programs, research, and real places of healing through the Heart-Based Medicine Foundation and the Heart-Based Centers.
Now, as we reconnect here, we're reflecting on that journey, where we began, what we've learned, and how this movement has grown. These 4 conversations close this chapter and open the door to what comes next.
We'll look back at how it all started, the journey. Then we'll explore how the principles in action came to life in daily care. Next, how Heart-Based Insights turned into programs and impact. And finally, what's ahead, the future and our invitation.
Thank you for being part of this story, for every listen, every reflection, and every moment of care you've shared.
Together, we're evolving healthcare into medicine with heart.
So today we're joined by Dr. Mandy Dolezal from UKIDOC, an integrative health centre in Basel and a long-term partner of the Heart-Based Medicine Foundation. UKIDOC was founded to bring together medicine and humanity, creating a space where families experience holistic, coordinated care. It's also one of the first environments where the Foundation's ideas took shape in daily healthcare practice. We'll explore how presence and listening can transform care, and how the 6 living principles come to life in real healthcare settings. So Mandy, welcome. UKIDOC has a unique story. Could you tell us a bit about how that began and what makes its approach different?
UKIDOC was founded to offer truly integrative care, bringing together conventional and complementary medicine for people and families all under one roof. From the start, it was really about collaboration and about seeing the whole person, not just the illness. Right from the beginning, UKIDOC was never just a practice. It was a vision to create a place of connection, a place of trust, where medicine becomes conversation and the healing becomes, a relationship. Mm-hmm. So here, doctors and therapists from many disciplines come together in openness, curiosity, and respect. They share their insights, they discuss with each other, they learn from one another and grow side by side. Over the years, this vision has really blossomed up into a living network. We have pediatricians, the nurses, the specialists, therapists, the social worker. Everyone brings his own experience, his own presence, and his own light. Honestly, what makes UKIDOC so special for me is its spirit, still alive, breathing every single day. Here, we don't just treat patients as whole human beings. We too are seen as humans too, with lives, joys, and struggles of our own. And that, I think, really matters, because how I am, how grounded I feel, how cared for, how connected shapes how I can be there for those who come to me. Basically, this is the quiet circle of the heart of UKIDOC. When we care for one another, healing becomes something we share, something we create together. Everyone who walks through our doors, whether a patient, a parent, or a colleague, becomes part of this living network of care. So there's warmth, there's curiosity, there's respect. It's a meeting of science and empathy, of knowledge and love, so that healing can unfold on really every level, touching both body and soul.
You explain it beautifully.
Wow.
It sounds like a vision grounded in reality. Thank you. So Jan, you were part of UKIDOC's founding team. What did you hope to create there in the beginning, and how did that experience contribute to the vision that later became the Heart-Based Medicine Foundation?
Yeah, it's a big question. It's a journey. We, as Mandy said, it started as a vision. It started as the idea of who says healthcare has to be the way it is. And could we do things a little different? And does it need a radical change or actually just a little tweak? And we felt that the radical little tweak was to allow ourselves to be human, right? To actually be authentic. And as we were working on this and trying to unpack what actually matters, not just as a philosophical idea, but in real life, tomorrow, 8 a.m. when I see the next client, right? Then what really matters are sort of different aspects of my inner state, right? And the key aspect is whether I actually care. Whether I actually truly sincerely care to be there, and whether I actually truly sincerely care to be with you as a client, right? And then the question is, what shapes that? What is it that contributes of really being there and really caring? And that's what gave rise to the 6 living principles, or sounds like, things you need to obey, but it's more like 6 aspects that are evolving. But those 6 we felt pretty confident about, that they are really critical elements to describe and to allow us to create an inner state that creates the energy and atmosphere that Mandy was talking about.
Great, thank you. Mandy, do you have a patient story that you could share with us where one of simple shift, say, for example, how you listen or how present you are when you show up as a doctor? Could you share something about that? And how did it change the way care was experienced by the patient, do you think?
Yes. So I remember this family who came in with their first child. They walked, like such a long road, years of IVF, a miscarriage, and then, finally, this tiny little miracle just holding in their arms. Yeah, and when I saw the parents, when I first met them, they were cautious, soft with love, but you could feel that they were so hard on themselves. You could really feel how deeply they wanted to do everything perfectly, and how afraid they were of making even the tiniest mistake. Every sound from the baby, every breath, every cry, they made the air feel tighter for them. Yeah. In moments like that, I would say it's rarely about my advice. It's rarely about what I'm saying, about my words. I think the most important thing is the presence. That just being there, really being there, listening with all my senses, without rushing, without judging, or trying to fix anything. Yeah, for many families, simply being met with full presence and deep listening is the first step to health. Giving space, what's already there, the worries, the love, the care, the tenderness, and also the fears that just waited to fall. Yeah, giving space for this, and sometimes it's the very first time that they can speak freely about something like this, and that they can let go the tension they've carried for so long. In between, I said something like, hey, we are both just humans doing our very best, of course, every day, but there's no perfect way. What really matters is your love, your presence, and your warmth, this gentle warmth you bring to your child. But it wasn't really these words, It was more, in this situation, the love you could really feel it, how it was flowing through the room. This gentle, really steady love that carried them, that softened them, and just held them. You saw that the parents could breathe again. They relaxed, and their eyes at the end, they brightened. And with that calm, they just finally start to enjoy their parenthood, more confident, more connected, and more at ease. So in that moment, that simple act of being fully present, truly listening, and holding space with love and care allowed them to feel supported, to breathe, to begin their journey of parenthood with calm, confidence, and connection.
Lovely. That's a true embodiment.
So important what you're highlighting here. And it's so beyond what we learn at doctor school, right? We learn to actually listen in a fairly manipulative way, right? We have to solve our doctor problem of, to arrive at a differential diagnosis, or to determine whether somebody is healthy enough to let them go home. And so we actually need to kind of tick our boxes, right? We need to know certain things from the clients in order to make an educated opinion, to form an educated opinion on what the state of health might be. And what you're describing is fundamentally different. Right? You're actually deep listening, right? You're not just listening to the words, you're not just using your five senses, as you said, but it's actually sort of listening with all of you, right? And so that takes a lot, right? That takes courage. That takes presence, as he said, to actually be there. And other principles come in, like autonomy and authenticity. You have to be well-centered to have the courage. And you have to give yourself the permission to be authentic and to share that love, which is not a common thing. Did you hear or experience from parents that, that they didn't want any of that? Did you get a pushback for being in the way that you describe you are, or for engaging or involving families in the way that you do? Are there families that don't want that?
So every parent, or every family, every human who is sitting in front of me is completely different. And of course, in the first seconds, minutes, and everything, I feel, is it this way, more the silent way, or is it more the powerful way, or the more, hey, today there's a joke and something like this? So completely different. And sometimes I try to be more on the relaxed side, or to be more on the feeling side. And then I feel, no, it's nothing this father needs. Yeah, it's okay. Yeah, I always try to get a feeling for this. Sometimes this works, and sometimes this. And that we go on one, that I find the energy, the line on which track I can get you. And sometimes maybe it's later that they feel, hey, now I need a more, maybe silent or whatever, relaxed, or talking about more feelings.
Right. Yeah, it's interesting that love doesn't have to be sweet at all, right? Yeah, so it comes in all sorts of disguises. And so what do you do in yourself when you show up and you don't feel like, oh, this is a tiny, sweet little baby and it's all very cozy, right? and everybody is like, oh, baby, Like sometimes that's not so much the case. Sometimes parents are frustrated about the baby, right? Or the teenager, right? And sometimes you're frustrated, right? Because you had something in your family, with your friends, or with yourself, or with Yukidoc, something that frustrates, right? Or made you angry or something. How do you deal with that? So what does authenticity and autonomy mean then?
I think it's so important that they feel that I'm a human too.
Right.
Yeah, I'm a human too. I am a mother. I get also stressed. I am also sometimes angry. That when we talk about their story, that I also say, hey, I feel you. Yeah, I know. I'm also a mother. I have a husband and everything. Yeah, but of course, these are my stories. I have to look at them at home, whenever, in my free time, whatever. Yeah, but I can share with them what I experienced, maybe, if it's the right moment at this time. Some little experience. Yeah. And then I can look if it helps. It's always a try. And then I will see, hey, yeah, this was something they also shared.
So what you're describing now is another principle, right? So you're opening your heart to another reality that might be different to yours. That's heart openness, right? So sometimes you're frustrated, and then actually heart openness opens the gate to attune to who's in front of you, the family, right? So then that moves you to resonance, right? So in order to establish a resonant field with the clients, it requires to be authentic, to be real. We know as pediatricians, we know very well that when you're not authentic, when the child says, oh, you look tired today, doctor, and you go like, oh no, I'm just fine. You lost them, right?
Yeah.
So that's such an interesting progression, right? So that is very different to what we learn in doctor school, right? What we learn in doctor school is to take ourselves out of the equation, right? Whatever you feel or your story has no space in the consultation room. And while, of course, we don't want to project our own stuff and bring it into the room, yet it is with you, and you have to have a way to be authentic with it, right? And that actually works better, right, than kind of pretending that everything is cool and putting up a facade that looks like a veneer, and every child certainly smells it, right?
Yeah.
What I'm hearing from both of you is the importance of preparation for yourself before you engage with a patient. You're really going through these principles yourself and embodying them. Do you have your own way of doing that? Is there a special something that you do to make yourself present or to bring yourself into the moment?
I think the most important thing is that I'm friendly to myself, that I always look, what do I need? I know, okay, I have this plan for the day. There are coming some patients. Yeah, the first start is how I prepare myself when I wake up, having some time for me. And even not just taking some minutes just for, okay, how I am feeling now at the moment, what's my topic of the day, and just looking when it's stressful, for example, that I notice it, that I really say, okay, this is a stressful day today, what can I do the next minutes just for me? Okay, and now I can go and look for you, what is with you. Sometimes it's just some minutes, sometimes I have a little bit more time, but it's so important that I care for myself.
Great, thank you.
And I think it's important to establish practices in the team, team practices. How do we feel together? How do we deal with situations where we are not in sync, where we're not in resonance, right? And how can we not be kind of all nice and smudgy about it, but actually get real, and say, hey, actually, this doesn't quite work for me right now, and address issues in knowing that we're a team and that it's totally okay to address something that doesn't work, right? And that's a trusted environment where that is okay to phrase in a respectful way and to take in a respectful way. And it's important to have almost like a choreography around this, right? So it's safe for both parties, right? Yeah. So again, love is not a sweet thing. It's actually work, right? It's actually about owning your shit, right?
Lifting the rug.
So this means that if I give myself permission to be kind with myself, right? And if I give myself permission to be authentic, then I recognize both of us as sovereign people, and so then I give you the permission to be authentic, and I give you the permission, and that makes it so much more relaxing, right? That is really relaxing, and
So important that we don't play roles. We don't play roles. No. You, Jan, and me working together. Yeah. And also with the patient, what you said. Yeah. Because then when I don't play a role, sometimes the patient, they feel this, or the parents.
Very clearly.
And they also play a role. Yeah. They look, everything is okay, no.
And it's untrue, and you know exactly it's not true.
Yeah. Let's talk about it now, not in a few months or years when the problem is there.
Yeah. So practices in the team and are easier, let's say, than introducing practices with patients. But we do that too. Right? So if there's a lot of stress in a family, then we actually have a look at what might be ways for the family to find practices around, increasing the parasympathetic, what are ways to actually step out of ping pong conversations, how can we recognize othering and how can we take responsibility and how can we step out of codependency and come into co-engagement. So all of these, if you like, trajectories that are available and that can be shared. And I am actually astonished in how grateful families are around that. So when we actually share these practices and say, I have a little practice for you, like a micropause, for example, right? So tiny things, right? So let's, give the idea of a micropause, give the idea of setting the tone in the beginning of the day. So little practices, right? Or whatever it might be, right? Usually there's extremely good positive feedback.
Right. Sure. Mm-hmm.
Yeah, there's a surprise that you hear this from a doctor, right? You don't get a pill.
Yeah.
And I think this works. It's sort of a slogan at Yukidoc is more skills, less pills, right?
That's a good one. Should have that over the door. Great. So over the years, Jan, you've distilled these experiences into 6 guiding ideas, often referred to as the 6 living principles. Could you tell us a little bit more about where that name came from? I know it's still evolving and we haven't fully decided that it will go forward as the 6 living principles, but the essence remains the same. But could you just talk a little bit about how they evolved and how they might still evolve?
Yeah, it's really learning in the field. It's observing closely, right? And that's really the essence of it, right? So when we initially felt that it's a really good idea to bring love and humanity back into medicine, or to kind of pick up that forgotten gem with all the research and the progress and all the fantastic things that life sciences have brought and are bringing, luckily so, and hopefully continue to do so. That we've forgotten a gem on the way, and that is about loving attention, about care, and to actually take that serious and to unpack what that means. And we were clear that this is a human superpower that we're not really bringing to the table as healthcare professionals because we have been told not to. Right? It is considered bias and it's considered unscientific, and so the last 200 years in progress in medicine were basically white male, right? And so that comes with ideas and concepts, right? And I think it's time to change that. Yeah. And the 6 living principles then were based on observation of what are the aspects of love that actually matter and where can they actually be practically applied, right? Where can we apply them without an extra effort, right? So how can they actually work in the field, right? And so over the first 5 years, when heart-based medicine was a project, right, before it was even a foundation, we started with that, and then that became kind of that crystallized. These elements started to crystallize, and we had different words, right? So presence was called deep listening, and then we went a little further, and autonomy was called personal sovereignty, and then we realized that there's a lot to it, but internationally it doesn't quite work very well. So we changed the terms, and the terms are likely to change, but the concept will stay.
So Mandy, from your work with families, how do they experience these principles concretely in your daily practice?
Well, in our practice, families experience these principles in very practical, everyday ways. Through honest conversations, through ongoing follow-ups, and through small, consistent changes that little by little help people regain health and really feel supported. There's another example. It was just last week. Mm-hmm. There was a mother who came in with their 9-month-old son just for a routine vaccination. Normally, this takes just some minutes. Yeah. Mm-hmm. And the son, he was ready, smiling, curious, full of life. And when I asked my usual question, everything okay? Yeah. The mother smiled, and she said, yes, she smiled at the son, and it looked pretty okay. But then there was just a moment, when she looked back at me, and I saw that there was something else, something more than she said at this moment. It was a bit of sadness, a quiet tension, a distance she carried really silently. And it was just a second, it could easily have been missed, but I could feel it. And therefore, I slowed down, I softened my energy, and I gently asked her, how are you doing right now? As I waited, the mother, she began to sense that this was a space where her truth could matter. Slowly, after a while, she began to talk that her husband, he was depressed, pulling away a little more each day, and he wanted no one to know. So the mother, she just didn't know how to cope with that. And then we sat quietly for a while. I simply listened to her. And it was the first time she had dared to speak with someone about this. When I listened to her, I heard that there was so much power in her, but also, of course, so much exhaustion. And we talked about what she could do for herself, about taking small steps, listening to her own heart, and acting in ways that felt true to her. Mm-hmm. When she came back for the next visit, she was so much lighter. Yeah, you could see it, so more open. And she spoke of a relief, that it was, a gentle release of the pressure she had carried alone for so long. She said she's felt so much better since realizing that she was also allowed to care for herself. And this really shows how in our daily practice, just being present, responding with care and love, and inviting the people to be their authentic selves can allow this healing to begin through our connection. Yeah. And of course, this takes time. Yeah. But I think it's so worth this approach. We truly invest in the future of the child. This child still depends so deeply on the well-being of their loved ones. And that really is worth every moment it takes.
So important what you say, Mandy, because when we're in an emergency mode, which doctors are trained to be, it's so easy to miss those seconds. Mm-hmm. And when you look at other situations, not the one last week, but when you look, just look back a few years of those families that you have, accompanied for a while, mm-hmm. Would you say that actually taking that time when it seems like too much is worth it overall, right? So when you look at it from 2:45 to 3 p.m., while you just want to give a vaccine, it seems like complete madness to listen to somebody's husband's depression, mm-hmm. right? Now, when you look back to similar stories years ago, would you say that investment, that mad 20 minutes that you took, does that actually pay back in the long term?
Yeah, of course. Yeah, of course.
Right? So that's such an interesting thing, right? Mm-hmm. Yeah, when I worked at the hospital in clinical care on the wards, is one of the things that I try to convey to every resident, right? Is that when you have an intake, take a crazy amount more time for that intake than you think you have, right? So take like half an hour or 3/4 of an hour, or let it be an hour, right? Everybody would attest that this is utter madness, right? Because it's too much time that you spend with the patient while you have so many other things to do. But actually, when you really listen and when you really build that relation and when you really let the patients experience that you're actually truly, sincerely interested and you're actually truly, sincerely available, it doesn't only give both energy, so you actually have more energy, it depletes less, but actually saves tons of time down the road. You have less of questions back, less of issues around a lack of confidence or a lack of trust. You have much less investigations. You have much less errands, medical errands, if I may call it, than when you don't take that time. And what you're describing is the same thing is true in private practice.
Yeah.
It doesn't only feel better, it's actually more economic.
Thank you, both. So these ideas, the living principles, or whatever we choose to call them next, are still evolving. They stay alive because they grow through practice, through every caregiver and every patient experience. Next time, we'll see how this living philosophy takes shape in coordinated family care and research, where heart-based care becomes measurable. Thank you for joining us for Heart of Healthcare. These conversations remind us how far this movement has come and how much heart and presence still guide the future of medicine.
What began as a reflection has grown into research, education, and real-world care through the Heart-Based Medicine Foundation. Each story, each voice, is part of that unfolding.
And as this chapter closes, we invite you to stay with us as we continue exploring medicine with heart.
Together, we are learning how heart and science can heal not only medicine, but humanity itself.
To learn more or support the foundation, visit heartbasedmedicine.org.